The broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, welcome to today's webinar, Health Careers 101, Educating Students About Opportunities in Healthcare. My name is Nicole Caban. I am the Education and Training Coordinator for Florida Literacy Coalition. Before we begin, I'd like to go over the webinar tools you have. First, I'd like to point your attention to your control panel, which is your main panel. And in the top left corner, you'll have a red arrow button. If you press that button, it'll dock your control panel and put it away, and you can press it again to bring it back out. If you don't want this on your screen while you're watching the webinar, you can put that away. Next, I would like to point your attention into your main control panel. There is a polling feature, and throughout the webinar, you will be asked to participate in polls. When prompted, you'll click the answer on the screen that pops up. So you won't see anything about it now, but when Heather asks you guys to answer a question, you'll just click on the answer that best suits you. Next is the question box. So please use a question box to ask any questions you have. This includes technical questions. If you have any technical issues, you can type it into that question box and I will answer it privately. Any questions about the content, please ask them as the webinar goes along. We will be stopping at a couple of different points throughout the webinar to answer those questions. All right, so with that, I'd like to introduce Heather Surrency. She is the Health and Financial Literacy Coordinator at Florida Literacy Coalition, and I'm going to go ahead and turn it over to you, Heather.
Thanks, Nicole. Welcome everyone to the Health Careers 101, Educating Students About Opportunities in Healthcare webinar. I'm so excited to be able to speak with everyone today about this fantastic resource, as well as other curriculum resources to help adult education providers to incorporate health careers into their curriculum. Also joining me today is Joan Dixon, who is the Director of Student Programs at Gulf Coast South Area Health Education Center. So Joan, you want to take just a moment to introduce yourself?
Hello everyone, this is Joan, and I know Gulf Coast South Area Health Education Center is a really long name, but you may commonly know us as AHEC. That's a lot easier to remember. And I am very pleased to be on this webinar presentation today to tell you some more information about the hot job trends in healthcare.
Thank you, Joan. We're very excited to have you join us. Joan has been educating students of all ages about healthcare careers for over 20 years, so she brings a lot of expertise to our webinar today. So I wanted to start by just talking a little bit about the Florida Literacy Coalition and what we do here. We were established in 1985, and we promote, support, and advocate for effective delivery of adult education and family literacy services in the state of Florida. So we're an umbrella organization providing training and all kinds of resources to providers. We work with more than 250 adult education providers throughout the state. We also manage the Florida Health Literacy Initiative, which is funded by Florida Blue, and that's one of my primary job areas. We have several award-winning curriculums, including Staying Healthy for Beginners, Coping with Stress, Women's Health, and then our newest publication that we'll be talking about today is Health Careers. So I just want to take a moment, if you haven't already heard, we are currently accepting grant proposals for the Florida Health Literacy Initiative. Those proposals are due February 15th. I apologize for that 4 at the end. I'm not sure how that got there, but it is due February 15th, 2018. And all the information about the program and how you could apply is located on our website. And at the end of the webinar, I will probably bring that screen up so you can see where that information is located. So today we have 3 general areas that we're going to talk about. First is career development. How can your program incorporate contextualized learning into your adult education curriculum? Second, as Joan mentioned, she's going to talk about some of the job trends. What are the high demand job areas in both the U.S. and more specifically in Florida? And then we'll jump right into the Health Careers Guide and how specifically it can be implemented into the curriculum, and what are some great learning opportunities and activities that your instructors can use with your students. So we want to start off with a couple polls just to get an idea of everyone's background and experience in this area. So you should see a poll in just a moment pop up on your screen. So just take a moment if you don't mind and complete that. So the question is career development currently part of your curriculum? One option is that it's a significant focus. Do you include it but it's not a primary focus? Or do you not really address it or do a very small amount in this area or primarily handle it through referrals? So I'll give you just another moment to complete that and we'll take a look at the results. All right, one last moment before I close it. Great, so it looks like about 67% of you are including it in your curriculum, but it's not a primary focus. About 13% of you do give it a pretty significant focus of your program, and about 20% of you are really not doing a whole lot in this area. So one other question that we had, I'm going to launch one additional poll for you real quick so we can get an idea. Do you think that most of the students in your adult education program attend classes as a way to increase their career opportunities? So just take a moment to complete this poll, and this helps us to get an idea of kind of the background of where everyone's coming from. So the webinar today is a general kind of overview of this program and a general overview of how to incorporate health careers into your program. So it'll be helpful to you if you do a lot of work in this area and also helpful if you are just starting out. I'll give you just another moment to complete that. Okay, great. So it looks like about 53% of you feel like it's one of many goals that your students have. About 33% of you feel like it's the primary goal. And about 13% of you feel that probably there's other goals that your students are focused on, or perhaps they already have employment and that's not one of their major goals. So when we look at research overall in the US, we do find that for a lot of students, finding a job is the primary motivator for enrolling in adult education. So when we talk about contextualized learning, we're talking about tapping in to students' motivations. And if students are feeling motivated to enter adult education programs in order to improve their skills to get a better job, we can use that information to really fuel their academic progress. We find that students that have career goals have higher success rates in adult education programs than students without goals. And again, we find that integrating topics that students are interested in helps students to acquire basic language, numeracy, English skills faster than when we only focus on their core subjects. So we talk a lot at FLC about this contextualized learning approach. It's the basis of our Staying Healthy program as well. It's helping students get their or work on their basic skills in language, reading, writing, numeracy, as I mentioned, but also by gaining additional skills in another area. So the curriculum we're going to be talking about today really helps to students to bring those two things together, to work on those basic skills while also working on their core job skills, such as their communication skills, their research and computer skills, their confidence, their ability to think and to react when they're in an on-the-job situation. So I want to throw one more poll at you. Oops. Do you think that most adult education students see an achievable path to success in terms of future career transitions? So it's really important that we help our students to see that they can move from adult education or a GED program into a post-secondary training opportunity, whether that's a short-term or up to 2-year program, and then to move into more job opportunities as a result of this training. So we can help students at every level in terms of career development. For beginning level students, they can really benefit from just gaining some general career education. But when we start talking about working with higher level students, they can really benefit from a targeted career curriculum where they're really focusing on what are the high demand jobs in the region, in the state, or in the US. So that's great. 64% of you do think that most adult education students can see an achievable path to success. And again, I think this is a vital component of career development in adult education programs. Sorry. So we really, as I said, want to help students to visualize success. And the state of Florida is committed to helping students to realize these dreams. And I'm sure most of you have heard of the Florida Workforce Innovation Opportunity Act. There's a lot of resources available to some of our qualifying students for job training and certification. Last year, 285,000 students in the state of Florida received training services from CareerSource, and they found jobs as a result of their training. So I want to talk about CareerSource a little bit, and we'll talk about it a little bit more when we get actually into looking at our guide. But they really provide some valuable resources and are continuing to update their website to give us even more information about what's available to our students. Another good resource would be Job Corps, although the age focus for Job Corps is 16 to 24 years old. So for CareerSource, many of you probably worked with them before, and there's a map on the screen showing all the different regions. And each region determines what are the high demand jobs for that particular area, and then focuses its training resources on these positions. Now, it's my understanding that it really kind of depends on the time of year that a student tries to register. Funding may not be available immediately. They may be in a wait list, but there are, as we saw in the previous slide, many students who are able to access training, financial resources, and career help from CareerSource. So this is an example for where I am in Orlando. The Central Florida Career Source provides very specific information on where you can even get training, how much the tuition will cost at the institution, and how much CareerSource will reimburse for. So great information for students, and we're going to talk in a little while about helping students to research different career areas and figure out financing, because that's definitely a big concern when people are choosing a future new career. Another example, so Joan is from the Gulf Coast area. So if we, actually, I'll put the link right there, but you can see the picture right here. I hope it's large enough. You can see what they have is they'll have by occupation, they have the training area. So if you were on the actual website and you clicked on the view programs, you could see all the different private and public institutions that offer that particular degree program, about how long they take, the average wage as well in that region of how much you would earn. So it's really useful information. So I encourage you to check CareerSource for your particular region to see how they provide their training information and resources online. Also, the state of Florida has Florida Shines, which is another great resource, and I checked it the other day, and on the home page it says how to pursue a profession in healthcare. So definitely this is an area that many people in many different areas are talking about. So I want to pause right here for a moment to see if we have any questions that have come in so far. So if you have any questions on that first kind of section, please feel free to submit them now. Nicole, any questions?
So far, we don't have any questions yet.
Okay, great. Well, feel free again as we go along to submit any questions that you might have. So we're going to move on now to Joan Dixon, who's going to tell us a little bit about job trends in the U.S. and in Florida.
Hello again, everyone. As Director of Student Programs for Gulf Coast South AHEC for about 11 years now, my primary job consisted of going out to middle schools, high schools. Heck, yeah, I would even talk to some kindergartners sometimes, just try and find out what they wanted to be when they grew up. And every time I gave my health careers presentation, I would always see adults in the back of the room looking very surprised and taking notes and asking me afterwards, why didn't I know about this? Why didn't I know how wonderful these health career jobs were and how even a little bit of training can make you really good money to support yourself in this field? And so we started thinking, we should be going around and doing presentations for places like Career Source that Heather just mentioned, but also Goodwill Industries, community colleges, anywhere and everywhere we can think of to spread the word about the hot job trends that are in healthcare. And by looking at this map here, the map to the stars, we'll call it, you can see by that red line that talks about education and health services, you can see that it has been going straight up since about 1990 and will continue to climb. And one of the things I tell my students is, think about it. Do you foresee any time in the future where everybody will be 100% healthy all the time? Never going to happen. There's always going to be broken bones that need casting or wounds that need stitching. And they don't even have a cure for the common cold yet. So there always is going to be a need for healthcare professionals. And when you have a need for that career, that means you're always going to be able to find jobs, and you will always be able to make good money because they need you. And you can't say that about very many other trends in industry out there right now. So when you're talking with your students, your health education students, adults, and trying to help them formulate a path for their future, they may consider thinking of health careers. They could earn a great living to support themselves and their families. Next slide, please. So what is a quote-unquote good job? The latest statistics show that if you need to be able to take care of yourself and pay things like the rent, your car payment, your car insurance, gas for your car, your cable bill, your water bill, your phone bill, electric bill, internet bill, groceries, you need to pull in at least $35,000 a year to take care of yourself and all of the basic bills. That is what is considered a good job, a minimum of $35,000 a year. And your students may be thinking, well, I'm going to have to go to school for that, and I'm probably going to have to be in school for a very long time. That's not true when it comes to health careers because, again, they need you. There's a critical shortage. They need you. So they may be surprised to find out that it may not even require a bachelor's degree to make good money in the health career field. For example, as we get on later into the Health Careers Guide, you will see examples like licensed practical nurse makes on average $17 an hour, and that's just 1 year of college-level training. Registered nurse makes on average $25 an hour, and that's just 2 years of college-level training. Respiratory therapist makes on average $27 per hour, and again, that's just 2 years of training. Now, of course, there are other careers in the healthcare field that may take less than 2 years and may be more up your student's alley. But we can always look at these health careers as a great family supplemental income and also as a great stepping stone to a further career. For example, if your student takes a 3-month class to become a certified nursing assistant and make $13 an hour but decides they need more money for their family, then they go back to school for 1 year become a licensed practical nurse. After that, go back to school for 1 more year. They can become a registered nurse. They can build upon the training that they have in the health profession to make even more money to support themselves and their families. Next slide, please. If they're wondering if this is only good for certain big cities in the United States, that's not true. And as you can tell from this graphic, when looking at the state of Florida has had a gain of anywhere between 20 to 50% in the growth of good jobs that don't require a bachelor's degree. So are there good jobs to be had in Florida? Absolutely. There are careers in health services. There are careers in the technical aspects of health and health skills. Because of all these service careers, technical careers, skills, these are the careers that actually keep the world turning. So we're always going to need more of them. Next slide, please. When you break down the statistics to see workers in Florida with good jobs, you can see the BA versus the non-BA is just about equal. Again, because these careers are highly needed, especially in the healthcare sector. As you're looking through this, you also may recall a time, for me it was many, many years ago when I was in school, we were always told that in order to make something of yourself, you needed to have at least a 4-year degree, if not more. And that's just simply not true anymore. Now the technical careers and the skilled services careers are recognized for their contributions to the workforce, and they're now being paid accordingly. Next slide, please. For the exploding growth of healthcare jobs, students may wonder, why health careers? How might this benefit me? They should keep in mind that in the state of Florida, we have an aging baby boom population. We have a very large number of retirees to the state of Florida for our beautiful sunshine and beaches. Because we have such a large population down here for elderly and baby boomers. I break it to you, but when you get older, things don't work like they used to anymore. So we need more healthcare professionals. You pair that with longer life expectancy, we're going to need more doctors and nurses and pharmacists and dentists and vet techs. We're living longer. We've got a lot of people in the state of Florida. And also, unfortunately, the growing rates of chronic conditions are going to continue to drive the demand for healthcare services. Next slide. You can Google many different hot jobs in Florida. You can see them written up in USA Today or Wall Street Journal, and every single one of these statistics that you come across. What are the best paying jobs? What are the hottest jobs? What are the jobs of the future? You are always going to see healthcare jobs in the list. Looking at this list right here from the Florida Department of Economic Opportunity, you will see of the 20 careers listed, 11 of them are health careers. And of those 11, 6 of them require less than 2 years of training. For example, physician assistant is 6 years, whereas a physical therapy assistant is 2 years. Diagnostic medical sonographer, 2 years. Medical assistant, 1 year. Cardiovascular tech, 2 years. Optometric assistant can also be called an optician, about 2 years of training. So there's plenty of opportunities to be had with less than a 4-year degree. And in conclusion, as I always tell my students, it's never too soon nor too late to decide what you want to be when you grow up.
Great. Thank you so much, Joan.
You're welcome.
Nicole, do you have any questions thus far for Joan?
I do have one question, but it's not particularly for Joan.
Okay.
Will we have access to the slides and audio of this webinar? Asks I'm sorry, Shanjayla. I'm sorry if I mispronounced that.
Absolutely. After the webinar, you will have access to both of these.
And that's it.
Thanks for the question. So we wanted to kind of give you a background of where FLC was coming from in terms of developing the Health Careers book. We talked about how we find adult education students are looking for ways to increase their career opportunities. We've taken a look at what are the job trends, and clearly the job trends in the US as well as in Florida is heading towards increased number of positions available in healthcare. So the Health Careers Guide to finding entry-level jobs in healthcare is a resource for instructors and program directors to use to begin to talk about these careers with their students. So the focus of this book is on careers that require less than 2 years of education. The majority of them actually require far less than 2 years. So just to kind of give you some basic information or highlights of our curriculum, it's a general introduction to health careers. So not every job is going to be included. We really let the listing we just looked at of high demand jobs between now and 2024 to determine the jobs that we chose for the guide. But there's many more jobs that are available. And I'll show you some resources that students can use to look at the many other opportunities. This guide is written at a 5th grade level, so we want to make it accessible to people who don't have much of a background in health. There are, of course, some terms that are rather difficult to understand, so we have an extensive glossary, as we'll see in a moment at the end of the book, to help students if there are words that they're unfamiliar with. It's designed to be used online as an interactive book because we do provide so many resources to access on the internet along the way of navigating through the book. It's perfect for implementation either one-on-one or in a group setting. So as we were developing this book, we worked with the Adult Literacy League, and I took it to one of their classes and we went through the book. And the instructor pointed out to me she thought this would be a great one-on-one opportunity. So she was going to teach both in a group setting and then work with students one-on-one to help them specifically with their career goals. So really there's so many options of how to use this. And then students can also navigate it themselves if needed. We have some spotlight pages, which I'll show you in just a moment, and there's one in this picture on this slide, which highlight the career ladder opportunities. And we feel like these stacking jobs are very important for students to understand, is that they, as Joan mentioned, nursing is a very high demand profession, but they don't have to start as a registered nurse. If they prefer, they could start as a home health aid and then work their way up through different certifications. So that's a really important theme of the book, that many of these jobs that require 2 years or less of training even have multiple steps within them. Other important themes that we try to weave throughout the entire book and through the Teacher's Guide activities is that training equals higher pay, which equals better job opportunities. And this is a theme that can be repeated for, as I said earlier, if you're doing general career information with lower level students, and as you get more specific with higher level students, this theme is so important for students to understand. And that many, I already kind of talked about the ladder opportunities, and we'll see that in each of the different job areas. We've talked a little bit about the training resources that are available and the resources students can use to look up what is available in their county. Some counties are going to have more resources, some counties may have less. But as Joan mentioned, it really exposes students to the wide variety of job opportunities. So I have a master's in public health, and I've been in the healthcare field for more than 15 years, and I learned some new job opportunities doing research for this guide that I didn't know about. So I think we can all learn as we go through the healthcare guide about all the many interesting possibilities, and they don't all have to involve direct patient care. You know, for some people, they may think, oh, I don't want a career in healthcare because I'm not interested in working directly with patients. that's just a small percentage of the jobs, and often the ones we hear about more. But there's so many positions also that are kind of in the background that support the direct patient care. So we're going to jump right into the books and explore both the Health Careers student version as well as the Health Careers teacher's guide. Secondly, we do want to recognize the Florida Department of Education for their support. Without their funding and support, this guide would not have been able to be produced. So we're very thankful for their role in this guide. So I'm going to click on this hopefully and go online, and we'll take a look at exactly what it looks like. So we do have, and I hope everyone has had a chance to look on our website. You can access this ebook on our website, and then we also have a PDF version, both black and white version and color version, if it needs to be printed out. We currently do not have any print versions because, again, we think it's so useful to use this resource online with all of the interactive internet resources that we will see. So I'm going to just kind of page through quickly and highlight a few things for you navigating. Again, this is a general overview for students. It's intended to help a student maybe new to career development as well as new to the area of health careers. Again, we try to really spend some time explaining climbing the ladder, the career ladder, or again, job stacking is another term that's often used. And you'll see that the key terms are highlighted, and we do have all of these highlighted terms in our glossary in the back. So as we kind of go through these general introductory pages, you can see there's a lot of good information for students to understand. For instance, what does median pay mean? What is starting pay? What is a pay raise? So again, when we were talking about contextualized learning, these are great opportunities for students to understand some basic math and numeracy principles as they're also learning about career development and what it's like to get a new job and what to expect in terms of pay. We go through the types of training, and this is something that we have a few activities on that I'll touch on in just a moment, but I really think this is very important for students. Again, when I did that focus group, I found a lot of students needed clarification. What is the difference between a certificate and an associate's degree and a bachelor's degree? Again, most of the jobs that we focus on in this guide are certificate-based, so they require less than 2 years, many of them around a year. So we try to give some specific examples and also show the pay for these positions to show that there often is a very strong link between training and average pay, and that typically an associate of arts degree position is going to pay a bit more than a certificate position, which is going to pay more than a non-certificate position. So a big concern for students is how to pay for training. So we try to provide some good resources here for students to start that process of researching. How would I pay? We talked about CareerSource, but also looking into grants and scholarships, looking into what are the different kinds of loans. We have some information here about the FAFSA application and how to complete that. And then we get right into exploring the different jobs in health. So there's a lot of different ways, different career pathways that healthcare jobs can be divided into. For clarity, we chose four for our students, including patient care, health information, imaging and diagnostics, and administration. We felt these have the highest number of jobs that require 2 years or less of training, and there's so many options within these four categories. So you can see we try to highlight some skills checklists. So if there is a student who's considering a job in patient care, what a great place for them to come see what are some of the skills that are required for these jobs. What kind of settings would a person work in a patient care situation. And then this is a very important page in our curriculum. It's helping them understand the different components of a job description. So this is important when choosing a career. This is important when applying for a job or looking at job openings online. So when I've worked with students previously, they really needed some assistance in understanding what even these classifications mean. What do we mean, again, by training in the different degrees? What is a job title? It can be kind of confusing because job titles often can change within an organization. So the same job may have a different title in one hospital versus a clinic, for instance. We listed the basic duties for each of the jobs. We listed what the next steps are. So again, that career ladder concept. Almost every job listed in this guide has a next step that a person could go on to if they chose in kind of a career progression. We have resources to learn more about every job. And then we have the starting pay and the median pay for each job. Now this information will change over time. It is current right now up to 2017. So it gives students a very good idea of what they could make in a profession or in a job right now in Florida. So we have different colors for the different job areas. So purple are the patient care jobs. And I wanted to choose a few jobs to kind of help you see how you could navigate with students with these different positions. Again, on the left, we show a patient care spotlight. We have nursing, and we show again those steps that can be taken to higher and higher levels. Over here, we have some other careers in patient care. So I'm going to click on the emergency medical technician, just for example. So we have a little job description here, provides emergency care to patients. EMTs work for hospitals, clinics, and ambulance services. Training is about 16 weeks. So these are averages of how much training takes depending on the institution. We used several community colleges within Florida to determine the length of training, the starting pay, as well as the median pay. So then we have these great resources for students to learn more about the positions. So this website is called Career One Stop, has great videos for students. So that's the first place that they can visit. What does an EMT do? This video is going to show us exactly what a person does. It's kind of a day in the life video. Okay, but if you look along the side here, we can see what the average pay is, we can see what the career outlook is, and the different types of training. Surgical technologist is another one I wanted to take a look at because there's even more extensive information on this position. Apologize, give it just a moment to load. So again, we can see the job description. Training requirements, 14 months. Starting pay is $16. The median pay in Florida is $20.50. So this particular job has even more resources. So really, unfortunately, there's more resources for some positions than for others, but we're continually trying to add information ourselves for all the different jobs. This one has projected employment, which I think is a great opportunity to, again, work on math and numeracy skills, talking about percent change in employment and how do you calculate that. Down here, they provide information on wages in 3 different formats: graph, chart, and table. So it's a great opportunity, again, with contextualized learning, help students understand how do they read this graph? How do they read the same information in the chart? And how do they read the same information in the table? Then this also tells what kind of experiences and education do people need to get started in this career. They have percents of how many people in this career have a professional degree, a master's degree, a bachelor's degree, associate's degree. So that also gives some good information as to who the competition might be in the job hunt. They talk about apprenticeships, activities that they might do knowledge and skills that a student might have. So it's a great resource for a student who is trying to research different occupations that they might be interested in. Also at the bottom, it suggests other similar career choices that a student could be interested in. So we have the same basic format for each of our 4 areas. Again, we have another spotlight on dental care, dental assistant being the first step, hygienist being the second, imaging and diagnostic jobs. So these are some that students may not have thought much about, EKG technicians or cardiovascular technicians, and those are stepping stone or stacking jobs. X-ray technician, dietetic technician. There's positions in administrative and support services. Again, we have the skills checklist that students can look at to see if that fits with their interest area and their skills. And then numerous other jobs that they can take a look at. I know one that Joan works a lot with in her organization, AHEC, is medical interpreter. So there is such a need for bilingual medical practitioners in all areas of health. So many of our bilingual students will really have an advantage over other students. And Gulf Coast AHEC has a medical interpreter certification program that Joan can tell you a little more about at the end. So we also have more entry-level jobs like a patient transporter, a 911 public safety person, dietary aid, so many options. And then health information and records is another area. Health unit coordinators work actually in typically hospitals, and they're administrative as well as clinical. We have admitting clerks, health records, health information specialists. Medical coding and billing is actually an area that is changing pretty rapidly, but is a good option for many students because they can do a lot of their training online if they're already employed or if they're already in school. We have a section for frequently asked questions, and then, as I had mentioned, the glossary. So I know I went through that kind of quick. I just wanted everybody to kind of have an overview of the student version of the book. But for many of you, you'll primarily be working more so with the teacher's guide. So the teacher's guide is available in a PDF form. Again, we have color and black and white so that instructors can print it out. And this is really designed to help provide instructors with activities and teaching tips to make the guide more interactive and relevant to students. And we realize that for many instructors, health careers is probably not their specialty area. So we try to make this introductory information as simple as possible to present. And we provide all the tools and information that an instructor would need. And page through just to give you an idea of what this resource looks like. So for each section, we do provide learning objectives for the instructor so they can clearly understand the goals that we're trying to teach students, as well as key vocabulary that will be used in the different areas. We make lots of suggestions, like having students look up or define the key vocabulary words, having students take turns reading the text to make it more interactive. So you can see we have teaching tips all the way through to help instructors. One area I didn't talk about is Florida Ready to Work, which is another great opportunity for students to receive certifications. It is a free program in Florida where students can take tests in different areas and become certified. It mainly focuses on some of the soft skills associated with career development. And then we go page by page again to help instructors to see, what are the differences between a career and a job, and how can you present that to a student and explain it. What are some ways that we can make it interactive? We can break students into small groups and have them answer some of the questions or digest some of the information on the page. So now I'm going to page down, and we have very specific class activities and projects to go along. So really it's going to depend on how much time the instructor has to devote to this topic, whether they want to do all of the class activities or only a few. We try to, again, focus in on core language, math, and other core skills that students need to advance their skills in adult education or if they're studying for their GEDs. So we have several different worksheets. But the one I want to talk about, here's pronunciation sheet. The activity I want to talk about the most is the healthcare research project. We really feel like this is a vital component of the Health Careers Guide in teaching students how to explore careers, how to research pay, how to find out which institutions they could attend, what the tuition is, what the graduation rates are. All this information, or much of this information, is available online, and we've provided the resources that students can use to do that. I would say that the instructor will play a very vital role in helping students to be able to find that information and be able to understand the content of that information. It's such a valuable experience for students to have. So we clearly lay out the different steps that a student would need to take to figure out if they did have a particular area they wanted to focus on, what steps would they take in that career decision process, in the process of deciding where to get training. Again, as I talked about earlier, the goal is really to help students to visualize success, to be able to visualize the path that they can take to start from adult education and move into post-secondary training. So speaking of that, I want to do our last poll. Which is, in your opinion, what do you think some of the barriers are for students who want to move towards post-secondary education? So if you have just a moment, I'd appreciate it if you could take it. We have several, and you can choose two of these options. Do you think it has to do with the difficulty in transitioning from adult education into post-secondary training? Do you think it's the length of time required for students to improve their skills to the level that they're able to be successful in post-secondary? Do you think it's a lack of self-confidence or a fear of failure? Could it be family, work demands, those types of barriers? Is it financing the degree or certificate program? Or is it just a lack of clear understanding of the potential options and how they would move forward? If you could take just a moment to answer that, I appreciate it. All right, I'm going to go ahead and close the poll. Okay, so it looks like about 55% of you think that the length of time required to improve skills is a major barrier, as well as 65% indicate that you think their students are really facing family and work demands. Also, 45% of you felt concerns about the financing, and 35% both for lack of self-confidence and lack of understanding. So it sounds like all of these factors really come into play in help in preventing our students from being able to see that clear path. And that's really, again, one of the great benefits of this Health Career Guide, is that we present such a general overview in a very accessible way to start to see what those steps would be to move forward to post-secondary education. And here's one area I wanted to talk about. So we were very lucky to have great expert reviewers and assistance with the Health Careers Guide. Joan was a huge part of this guide, as were several people from Santa Fe College. And they told us about a project that they do, which is using contextualized learning like we were discussing earlier. The way that they do this is through certifying their students to be certified in American Heart Association's Basic Life Support Program. So one of their instructors actually became a certified teacher and does this as part of their Health Careers adult education curriculum. It's a great opportunity for students to gain confidence in being able to achieve a certification. They learn all about the human body. They learn a lot of different medical terms. So this is a great opportunity for an adult education program to be able to take pretty complex information, chunk it into smaller bits, and teach it over a longer extended period of time. So usually this class is about 8 hours, and at Santa Fe they extend this to over around 20 hours. And if students do not pass the test the first time, then they're welcome to go through that training again until they can pass. So it's a great confidence builder. So there's a lot of like very creative ways that we can contextualize vocabulary, communication with health careers and health information. And we have a number of resources available for instructors, including additional curriculums, as well as some of the state of Florida resources that are available, and then some of these other places to explore different careers. So this is one of the best websites, so I just wanted to bring it to your attention. It's called explorehealthcareers.org. It is a nonprofit website. So we found in our research it's very difficult to find health information that doesn't have a lot of ads or have kind of an advertising purpose. So the purpose of this truly is to educate people. There's many different tools that students can use. It can be used in general. They can choose the number of years that they want to spend in school. They can choose their salary and see what job opportunities might pop up. So that's one way that they can use it. So you can see for my up to 1 year in school and my salary of $30,000 a year. We'll see what it comes up with for results. So there's several different jobs that it suggests. You can also look it up by a particular job. So if I'm interested in being a nurse, for instance, well, that didn't work, but in theory, I can search a particular position and it will help me with that as well. It also has a lot of just basic career development information for students. Is a health career right for a particular student? What do they like? What do they dislike? Again, some information about paying for college and additional resources. So this is a great website for students to use. So again, just to highlight some of the things that we talked about with the curriculum, the activities that are in the teacher's guide provide the opportunity for students to develop a lot of the core skills that we've been talking about and that you are teaching every day: math skills, research skills, language and vocabulary skills, as well as communication skills. So we mentioned that Health Careers Research Project. It's just so beneficial for students to collaborate with other students and actively work together to use the skills and information that they've gained in the class. So I really think that this project could be life-changing for a lot of students to be able to see again that clear path. It helps to improve confidence, professional success, and it really illustrates the connection between the classroom and real life experience, which is what we're hearing a lot of students say that they need. They need to see that clear connection. And it really meets the needs of a lot of different learners, because I know some of the students that we have perhaps have had a difficult history in the education system. They may have differing levels of skills. So really doing a research project like this collaboratively, whether it's a class or if they pair into a small group, can really improve their skills and confidence. So some of the additional curriculums I wanted you to take a look at, the San Francisco Welcome Back Initiative. Unfortunately, they went out of business, but they did leave us with some wonderful activities. Everything from worksheets on language building to stories to project ideas. Same for the Center for Rural Health at University of North Dakota provides a very good curriculum to be used. Links has a healthcare careers pathway publication for instructors and for program directors of how to incorporate this career component into the curriculum, a lot of what we talked about today as well. And I wanted to provide you with some additional state of Florida resources. So Nicole, do we have any kind of questions on the teacher's guide or the student version of the guide?
We actually have a couple of comments here. The first from Amanda Valdespino. She wanted to mention that another barrier is when adult learners might have a specific learning disability or difficulty. It might also be a barrier that wasn't mentioned here.
You're exactly right, and we do have right here a great resource to help with that. There's additional funding and additional supports for students who have had learning disabilities, who have other issues where they may need some additional support. It's a great point.
Okay, and we also have a comment from Greg. One added advantage to doing the CPR/first aid class in adult ed is that students walk away with a professional certification required for many entry-level healthcare professions.
That's right. Thank you, Greg. I did not mention that, but that is another great benefit of this program, is that it is required for pretty much any healthcare job that has any kind of patient contact. Thank you.
And I think that's it for the comments and questions.
Okay. Joan, anything you'd like to add?
No, I think that this is a wonderful health careers guide that has been put together, and hopefully we'll be able to recruit some more students into the healthcare professions and meet the critical shortages that are out there.
Great. Thank you so much, Joan. Well, I encourage everyone to navigate through the guide yourself. Feel free to contact me if you have questions about implementation or questions of kind of next steps for using this guide within your organization. We greatly appreciate your time. And again, this is available for free download on our website, both the teacher's guide and the student version. So I do believe right after we log off of the webinar, there will be a brief survey for you to fill out, and I would appreciate everyone's input on today's webinar. So thank you very much for joining us.